look at objectives of human resource management in healthcare system as part two of the previous session. So our objective number one is to attract and maintain a competent and diverse workforce. So when talk of competent, we're talking about people who are qualified, people who can do the work as expected. And on top of diversity at workplace, we're talking about having a workplace which is mixed up with different people from different regions, different region, tribes, etc. So if you're a human resource manager but you have a workforce which is only of one religion, that means you are ignoring other religions, and it's going to be very dangerous as far as managing human resources is concerned. The government will come in and question your recruitment process, etc. So make sure that you have working environment which is mixed up with people from different background, region, etc. And most importantly, you need to have female workers as well. So if you have workforce which is basically male, no female, you're in trouble. You will be taken to court by the female potential workers. So as a human resource manager or admin in healthcare setting, you need to make sure that you have the mixture of the workforce. The next objective is to develop and maintain high performance work environment. Human resource is all about performance. In healthcare setting, we are talking about treating patients. When patients are being brought to the facility, we expect the doctors to work in order to make sure that the patients are recovering. That's what we call performance. But with the other organizations which are not implementing a health intervention program, for example, I can give example of maybe profit-oriented companies. The performance is all about making profit. How much have we realized by the end of the year? That's what how we measure the performance of organization. But for you, the healthcare workers, we measure your performance at the rate of patients who are recovering. So if the hospital is registering high death rate, it means there's an element of underperformance in the hospital. So it is the work of the human resource management to make sure that the doctors are doing their best, the nurses, the midwives, whoever is involved in treating of the patient is doing his or her best. That's what you mean by high performance working environment in the hospital. The next objective is to promote a culture of safety and quality patient care. When the patients are brought in the facility, we need to make sure that they are safe from external threat security. That means you need to have hospital which is fenced, you need to have security system in place, the CCTV camera to see whoever is following these patients. So the patient should not come to the facility, then someone follows him or her and then hurt that person within your custody. That does not make sense. So as a human resource, make sure that that safety is always there to take care of the patient. Not after only the patients, even the employees, the doctors, the nurses, their safety is also priority. So it is the role of the human resource to make sure that such culture is implemented in the organization. The last objective of human resource management in healthcare setting is to foster employee well-being and satisfaction. So in terms of satisfaction, we are basically refer to a situation whereby a doctor feels authentic or happy with the job he or she is doing. When your doctor is complaining, that means the doctor is not satisfied, and chances are high that the doctor might end up resigning to go and look for where he or she feels happy. So job satisfaction is very important as human resource managers. You need to make sure that each and every employees are satisfied with the job they are doing. There are so many factors to consider. For some people, job satisfaction is all about high salary. But I want to tell you that paying employee high doesn't mean the person is satisfied because by law, everyone is entitled to salary. And also in human resource setting, we don't pay people, we actually pay the work they are doing. So by doing that, you are not satisfying me as an individual. What satisfies me is maybe the working environment, the tools, the machines I'm using at workplace. If it is efficient enough, I'm satisfied. But if you're operating a computer which takes 1 hour to power on, I don't think you're going to be satisfied with that job just because of the computer. So as a human resource, make sure that the facilities is equipped with the modern machines or technologies which allows the employees or the doctors to really enjoy the work they are doing. So basically, these are some of the objectives among others, of human resource management as far as healthcare professionals are concerned. So having looked at that, I want us now to focus on the function of human resource management in healthcare setting or hospital. Number one is the recruitment and selection. So here the human resource identify and attract qualified candidates for healthcare positions. You know the healthcare positions we're talking about here, the nurse, doctor, with, and then even lab technicians, etc. So it's the role of the human resource to make sure that when they are advertising, the qualifications, the experience, etc. should be clearly stated, and even the job descriptions should be clearly written. Because when a potential applicant is looking at it, the person will measure it against his or her qualification. If you're looking for a master's holder, I'm sorry, please keep your microphone muted because I'm recording this session. I don't know who has just been joining us. This could be Benjamin. Benjamin, keep your microphone muted. I'm recording this session. Keep your microphone muted. Benjamin, keep your microphone muted. I will mute you from here if you don't want. Keep your mic. Okay, thank you. Thank you.
Chắc chắn tìm bao cái giá cái lối internet ha còn là cái đó nó cũng về
tidak bukan tidak betul kita nggak start kira dia
I'm muting, but you guys still don't have. So. Okay, okay, fine. All right. So if you are here, please don't make your microphone open. Don't leave your microphone open because we are receiving noise here. I'm recording this session. All right. I was talking about function of human resource management in healthcare setting. I talked about recruitment and selection, whereby I talked about the qualifications of the person you're trying to recruit. So this begins when you are advertising for a position. Make sure that the design qualification is clearly stated because the person who's applying for that job can measure it against his or her qualification, whether he is eligible for the position. That's number one. Then number two is training and development. So recruitment selection is not enough. Recruitment only helps you to acquire employees for the organization, but training is very important because of emerging technologies. You need to make sure that you train the person you have just hired in handling some of the machines you have in the organization. So it is the role or function of human resource to make sure that each and every employee in an organization at least receive training. Training helps the employee motivated. It also helps to improve the performance of the organization. The next one is performance management. The human resource management is responsible, or the human resource department is responsible for managing the performance of doctors, for managing the performance of the midwives, the nurse, etc. by setting clear expectations. Okay, you need to set a goal and then see whether the doctors, the nurse are achieving those goals. And at the end of the day, you need to also to evaluate them. Because if you set a clear goals without evaluation, then you will not be knowing whether the doctors are performing or not. Evaluation is very important. We call it a performance appraisal. You need to appraise their performance against the set standard. If there is underperformance, an element of underperformance, you need to make sure that you train the employees to improve on the areas of weaknesses. This will help to improve individual performance, but also you are directly or indirectly improving the performance of the entire organization. So that is the function of human resource management in healthcare setting. So we still continue with the function of human resource management. The next one is compensation and benefits. So the human resource manager or the human resource department design fair and competitive compensation packages and benefits program to attract and retain talent. The job market nowadays is all about compensation. People are interested on how much the organization is giving. If they look at it as underpayment, then they will not be able to apply for any position in your organization. So they look at that as a human resource manager. What is the implication? The implication here is that you need to design a competitive salary structure. You need to look at what other organizations are giving to their employees. How much is doctor in other organization is earning? How much is a midwife in other organization is earning? That will help you a lot in determining a very competitive salary structure. But if you don't do that, you may end up designing a salary structure which is low. And what happens if the payment is below the expectation? Of course, people will not be working, and that's what is driving the labor market now. We have some reputed organizations when they advertise, everyone feel like they want to work with them. The others, when they advertise, people are not with them because of that element of compensation. So you don't need to also overpay your staff because you want to attract. No, it will constrain you financially. You need to make sure that you balance it. It has to be very competitive yet affordable by the organization. So that's about compensation management. The next one is employee relations. So addressing employee concerns, resolving workplace conflicts, and fostering positive relations. So we have strikes. Okay? Some employees are striking because of underpayment. Some employees are striking because of delayed payment. Others are striking because of unfair work policies, whereby you work from Monday to Saturday, Monday to Monday, 6 to 6. No leave, no nothing. Even on public holidays, you are working and you are not being paid. Such kind of things normally uh, arise in an organization. So it is the human resource department to make sure that such issues are resolved amicably. Because if the employees decide to take you to court or to report you to the labor commission, you're going to pay heavily, and then the reputation of the organization is damaged. So reputation management is very important. You need to make sure that you manage the reputation of the organization or the hospital where you are working in. So basically, these are some of the functions of human resource management in healthcare. There are very many. You can talk about complying with the labor law, you can talk about the policies related to health professionals, etc. But for the purpose of this presentation, we have four, but it does not mean they are only four. You can do more research and find out some of the functions of human resource management. Having looked at that, I want us now to look at the difference between human resource management and the personnel management. It seems to be the same term but with slight difference. So I want us to focus on the slight difference between the two keywords. We are beginning with the features, then the personnel management, and then the human resource management. So we are starting with the definition of personnel management. Okay. Under personnel management, we are saying that it is a traditional approach focused on administrative tasks such as payroll, attendance, and compliance with the employment laws. Why are we calling it traditional? We are calling it traditional because it basically focuses on the daily activities the employees are doing. It focuses on basically payment the employees at the end of the month, give their salary, and also you expect the employee to comply with the labor law. That is the personnel management in the context of its definition. Now, with the human resource, we are saying that it's a modern and a strategic approach that views employees as valuable assets and emphasizes their development and their well-being. So, under human resource management, we look at doctors, we look at nurses as a valuable asset to the hospital. If the hospital is to grow, and if you think that the doctor is valuable too, of course, you need to develop them. If you think that nurses, the midwives, the lab technicians are very important asset to the organization, you need to develop them because the more you develop them, the more strategic you are putting organization to grow. So that's the difference between human resource and personnel management in the context of its definition. The next one is focus. Personnel management basically focus on routine tasks, what you can call the job description. Okay, what does a nurse do in the hospital? Checking the patients, administering medicine, okay, recording the symptoms or if there's any sign of improvement, etc. So these are the daily activities being done by the nurse. So we call them job description under personnel management. But if you are to define it under human resource management, you can say it is strategic and proactive, concentrating on long-term organizational goals. long-term organizational goals, it depends on different organizations, the hospital where you're working for. Some organizational long-term is to make sure that they reduce the death rate in a country or in a region. If that is the long-term goal of the organization, then all the effort is put in a way that the organization finally achieve that goal. If it's all about reducing maybe the rate of maybe malaria cases in South Sudan, okay, all the efforts is done towards what reducing uh, the rate of malaria cases in the country. So that's all about being strategic and proactive in human resource. But under personnel management, we're basically focusing on what you do today. Basically, you don't mind about what you're going to do tomorrow for the organization in the context of their focus. Now, in the context of nature, they say that personnel management is reactive in nature. Okay, when we talk of reactive in nature, responding to issues as they arise. The employee has resigned, you need to think of recruitment. Okay, the employee is complaining of maybe underpayment, then you act to maybe increase the salary. The employee is complaining of unfair working condition or environment, then you act. So you just wait for the issues to arise as a manager, and then you act on them. But under human resource, it's all about proactive. You anticipate those issues to arise. And this is what we encourage, and this is what we normally encourage from our students. You need to be proactive instead of what? Being reactive. Reactiveness is more of a traditional approach. So we're living in a dot-com era, modern era, whereby you anticipate things and plan yourself accordingly so that you don't fall a victim. So that's about human resource management. Anticipating those things. If it's about resignation, you anticipate someone to resign, you need to plan accordingly. But by the time the person is resigning, it is not getting you unaware. So the next context is the employee relations. Personnel management, we are talking about maintaining good relations through compliance with rules and regulations. So here, if you don't comply with the rules and regulations, it means you are not maintaining good relationship. This is about personnel management. But with the human resource management, it focuses on building positive relationships, employee engagement, and foster a healthy work culture. So when we talk of a healthy work culture, we are talking about a culture whereby employees' voice are heard. Okay, employees' problems are solved. The working environment, the working condition is good. Employees are involved in some decision making through consultations. So the top management does not decide without consulting the employees. That's what we call building a positive relationship. The last one now is a decision making. Decision making are top down and based on rules and procedures. So when you talk of top down, you know what it means. The high management is making decisions without informing the lower management. I talk about the CEO, the general manager, the director general, they are the one making the decision. For you who are under here, you are not consulted. That's about personnel management. So under human resource management, we have a centralized system of decision making whereby each and every employee is involved in the decision making process. Doesn't mean you are given freedom to decide, but through consultation and review of the majority employees in an organization, then the top management can make their decision based on that. So basically, these are some of the differences between personnel management and the human resource management. So having looked at the differences between the two keywords, now let us look at the dimensions of human resource management in healthcare. Number one is personnel management. That's dimension. In other books, they call it the scope of human resource. If you hear about the scope of human resource management or dimensions of human resource management, these are the things I'm talking about. Number one is the personnel management. Personnel management deals with records, employee database, okay, could be academic qualification, could be the CV, the job description. It's basically about administrative records, keeping the record of the employees. Which employees are we talking about here? Our focus is on the health professionals. You know them. The next dimension is the staff welfare. The staff welfare is all about having flexible working conditions whereby everyone is not overworked, having refreshment or what we can call lunch at workplace. Even some organizations they provide breakfast at workplace, having restroom, sometimes gym. So these are some of the things we do to make sure that the welfare of the staff is taken care of. So that's another dimension or scope of human resource management. Then the last one is industrial relationship. And industrial relationship, we're talking about maintaining good relationship between the employees and the employers. Employers in this context is the organization or the hospital where the doctors, the nurses, the midwives are working in. So that relationship has to be maintained because if it's not well maintained, then it will lead to strikes, chaos, etc., which can involve some of the law enforcement agencies, which is not good. So, as a human resource manager in the hospital setting or in the healthcare setting, these are basically the things you do, or these are the things you're going to deal with: records, welfare, and maintaining positive relations with the employees in an organization. So, these are some of the dimensions of managing human resource in healthcare setting. So having looked at that, now I want us to look at human resource development in health care. We're basically focusing on the characteristics and some of the challenges. Number one is characteristic is we are saying that it is ongoing training programs to keep healthcare professionals updated on the latest medical practices, technologies, and regulations. So human resource management in healthcare settings is quite different from other organizations because in healthcare settings we have some rules regulating some of these healthcare professionals. We have the registered nurse, midwives, a lot of certification required from these healthcare professionals before they start actually working. As a human resource management or as a human resource manager, you need to make sure that you are familiar with those regulations because if you are not, then you will not do anything, you will not succeed in your role as human resource in the hospital setting. So we have technologies coming in. Okay? We have new medicines coming in. So if you don't train these people on those programs, then they will not be knowing exactly what's happening in the world of medicine. They will not know. Okay? As a human resource manager, you need to make sure that you always train them on such programs. The next characteristic is deep understanding of and compliance with the healthcare regulations, accreditation and standard and licenses requirements. I think these are some of the things I have been explaining. The human resource here is not like human resource in the business sector. Please, please, you're making noise for us. Make sure that your microphone is muted before I mute you. Thank you. So deep understanding of and compliance with the healthcare regulations, accreditation and standard and licensing requirements, I've just explained about that. Managing human resource here is a little bit unique because the doctors they have to be accredited, they have to be regulated, certified before they start actually working. That means you can spend 7, 6 years at university studying medicine, but after that, of course, you need other certification for you to be qualified to work in the hospital or in an organization which is offering health intervention programs. Then the next one is a continuous learning and development. So human resource development is all about continuous learning. Even the professors, they're still learning. Okay. Don't say that for me, I have my master's, I am not going to learn, or I have my PhD, I'm not going to learn. That's not good. You continue learning, you continue developing. So it's a culture of continuous learning and development is fostered by providing diverse learning opportunities for employees. The learning opportunity for employees we are talking about taking them for further studies. If you have employees in an organization, make sure that they are up to date. I'm impressed that most of you here are upgrading. That's what we call by continuous learning and development. So you also need to promote employees to higher positions because when you promote them, you are expanding on the scope of what they do, you are adding to them more work to do, and they are learning and also developing themselves, and at the same time, the performance of organization is going to improve. So these are some of the challenges and characteristics of human resource development in healthcare setting. So we're still continuing with that. Challenges now. At first, we're looking at the characteristics. Now we're looking at the challenges of human resource development in healthcare. One is the limited resources. So resource like finance, resource like even the human resource itself is limited in the context of South Sudan. If you look at most of the programs, health intervention programs in South Sudan, they are being sponsored by international NGOs. So these NGOs sometimes they run out of budget. So when they cut the budget, it means the organization is affected. So your plan to recruit more doctors, your plan to recruit more nurses will not work because of the budget constraints. So these are some of the challenges we face in human resource development in healthcare setting. The next one now is the rapid technological advancement. So the rapid pace of technology change requires healthcare professionals to continuously update their skills and knowledge, challenging HR development, relevant and timely programs. We have software to be used. We have the X-ray machines. Okay, all these X-ray machines you need to train people to operate them. You might find that at university level they don't train people on how to operate the X-ray machines. We have very many equipment, okay, which are used in the hospital. You have to train your doctors, your employees on how to use these materials. And this is because of the technology. Otherwise, if technology is not there, then you may not need to think of spending money on training these employees. So these are some of the challenges of human resource development in healthcare setting. The next one now is we are going to look at factors impacting human resource management in healthcare setting. We have external and the internal. We are beginning with external factors. With external factors, we are talking about factors which is out of the reach of the organization. The organization does not have power to avoid them. They just happen. So here you don't blame the hospital, you don't blame the organization, the NGO for those factors. Number one is the economic conditions. If we have fluctuation, it really affects human resource. The budget, hiring, training, and retaining staff becomes very difficult when the economy is not doing well. For this matter, do not blame the human resource department because the general economic condition in the country or in the world is not favorable. So therefore, we term this under external factors. Okay. The next one is the legislation and regulation. This one happens with the government. The government is responsible for setting laws to be followed by this organization. So it's also out of the reach of the organization. The human resource manager at this point has no choice but to comply with those laws. If the laws are harsh, then the organization suffers. Okay, so legislation greatly affects the human resource management in an organization. For example, in South Sudan labor law, jobs are supposed to be taken by the nationals, but where the skills is not in the country, expatriate, the organization can hire from outside. So in this instance, if you do not have maybe someone who is competent enough to do the job, it means you have to hire from outside. Okay, so that's how it affects the organization or the human resource context in the organization. Another example of that is that if you have someone who you think is competent enough, but he's not a South Sudanese, maybe the person is a Ugandan, is a Kenyan, you cannot hire this person as a nurse. You cannot. Because the law does not allow the person to work in South Sudan unless an expert. These are some of the regulations which affect the human resource management in a hospital setting. The next one is the labor market trend. Availability and scarcity of skilled labor also affect what? The ability of the human resource management in an organization. People now look at what is the trending in the job market, which skills is highly required in the job market. Okay? For example, if doctors are now few in the job market, it has implications in the organization. It means you're going to spend a lot of money on the doctor because they are few. But if the doctors are very many in the job market, it means you just spend less because after all there are many. The first one doesn't work, you get the next person. But when there are few, my dear, you have to spend heavily on them to make sure that you put them to work in an organization. So what is happening in the job market? also affect the human resource management in the hospital. So these are some of the factors under external which affect human resource management in an organization. So having looked at the external factor, now let us look at the internal factors which affect the human resource management in an organization. One is the human resource policies and practices. This is now within an organization. We call it internal factors because it has the organization has control over it. Okay. So number one is the human resource policies and practices. Every organization has. Please keep your microphone muted. Keep your microphone muted. Just a minute. This is Benjamin. Benjamin, I think I will mute you. Benjamin, keep your microphone muted. Thank you. So I was talking about the human resource policies and practices as internal factor which affect human resource. We can talk about the recruitment selection methods, performance management system, compensation, etc. affect the human resource management in an organization. For example, some organizations they prefer internal recruitment. Internal recruitment means you get employees within the organization, you get employees within the system of the organization. With such kind of policies and practices in place, you will not get an expert or someone who is more experienced externally because the policy requires you to recruit within the organization. That one has impact on the organization. Then the next thing is also the payment. Okay, in some organizations they have a payment limit whereby no one earns beyond $1,000. If you have someone who is an expert, extremely talented, but is demanding for more than $1,000, it means you're not going to recruit that person just because the policy does not allow you to recruit people who are over earning. So it affects the management of human resource in healthcare sector. The next one is organizational structure. Okay. When talking of organizational structure, we're basically focusing on centralization and decentralization structure. In a centralized system, we're talking about the top management making decisions. With the decentralization, we're talking about giving power to the lower managers to make decisions. That one also affects the human resource management in an organization. For example, if you work in an organization in the hospital where the CEO makes the decision, then you as the human resource manager, what will be your function? What will be your role there? Be just like a child who just to be fed because the CEO takes the decision. Okay, you might have your professional view on how to do the recruitment, but the CEO comes here and then decides on what is to be done. So that's what affects your performance as a human resource manager in an organization and has implications on the entire organization. The next one is the workforce composition. Workforce composition, we're talking about the demography of the workforce. Okay, people from different regions, people with different skills also impact the organization's performance. For example, if you have a workforce which is all female, you don't have male workers, then when we're talking about doctors, when a male patient comes in with a very sensitive case, the female doctor will not come because one, the male doctor will be feeling shy. It means about seeing the private part. The male doctor will feel shy because of the female doctor. But if you have a mixed up environment whereby if a female patient comes, goes to the female doctor. If a patient comes, the patient goes to the male doctor. That is much better. So workforce composition greatly affect the way organization does its work. Then the last one is budgetary constraint. I think I've already explained what it means by budgetary constraint. Financial resources is limited to finance some of the human resource activities. The biggest budget in humanitarian setting goes on the human resource. So if you go to these NGOs, they spend nearly 80% of their budget on paying the employees. You can see how it can constrain the organization financially. So it really affects. When the budget is small, implication is that the organization will start downsizing, okay, terminating some employees' contract because there is no budget. But if the budget is there, of course, the organization can recruit as many as possible. So these are some of the internal factors which affect human resource management in an organization. So lastly, let us look at the factors which influence availability of human resource for health. What are those factors? Number one is education and training. Availability of qualified professionals based on education programs and training facilities. In the context of South Sudan, how many doctors do you think we have? How many are they who are qualified? You might find that they are few. Okay? That is the effect of education and training on the availability of human resources in healthcare. Doctors are not very few. Majority are studying business, arts, and some IT courses. If you go to University of Juba, in the Department of Medicine, how many, and you compare to the Department of Arts or Agriculture, you find that there's a big difference. And that is how it affects the number of or availability of human resource for health. The next one is the economic condition. I've already explained the economic condition. If the economy is not doing well, it means employees are getting low salaries. Okay? For example, you're working in a private hospital, which is the profit oriented. Patients are not coming to receive services. How are you going to pay the employees? How are you going to pay the doctors? How are you going to pay the nurses if patients are not coming? We don't encourage people to fall sick, but the hospital needs to treat patients to get money. Those private hospitals, I'm talking about the private hospitals. Okay. So that's how economic conditions affect the availability of human resource. And then people end up changing. Instead of being a doctor, wherever I'm receiving low salary, then you join politics. People have believed that in politics there's the money. I was like, okay, let me do my own business. Someone resigning as a doctor to ride about a border. It looks funny, but the person is earning some good money. Okay? That's how economic condition affects the availability of human resource for health. The next one is geographical location. In the villages, you find that doctors are not there. They don't want to be in the village. All of them want to be in the city, in towns. So creating huge vacancies in the village. So geographical location also play a big role in availability of human resource. That's why some NGOs they hire people from the town, then they take them to the village, what they call now field. If there's someone going to the field, just because in that location there are no doctors. People don't want to stay in the village. They believe that money is in town, but which is not true. Money is everywhere. The last one now is the migration and brain drain. We're talking about movement of a professional to another country. You don't feel happy working in South Sudan as a doctor. You feel like when I go to Egypt, I will make more money as a doctor. You go to Tanzania, okay, you go to Ghana, just because they are paying no class very well. That's what we call migration and brain drain. So by doing that, you are creating vacancies in South Sudan. No one is going to fill it. Assuming that you have 1,000 doctors in South Sudan, 700 are now moving abroad to look for jobs. They remain only 300. What can 300 doctors do in South Sudan? Okay. So that is how migration and brain drain affects the availability of human resource management in healthcare sector. So that's what I had for you in this presentation. Like I've told you, this is the second part of the first one, which we did not finish because of internet, I mean power. So with that, we have come to the end of this presentation. Let us meet tomorrow for another session, but on performance management and the development. So for now, I'm going to